Thank you very much for the opportunity to participate in the IFFGD's 2020 virtual advocacy event. Today we're going to talk about what to ask your healthcare provider before you leave, or in other words, what questions you should be sure to ask, and moreover discuss what do healthcare providers wish people would ask during their office visits. So some objectives to clarify before you leave the office visit, or in these days, in some cases, a telemedicine visit, are really five things that I would encourage you to address. The first is to confirm your diagnosis. Second, to verify the evaluation and treatment plan and to clarify your expectations as well as the expectations of your provider. Next, to address the next steps and milestones that we hope to achieve through your treatment plan. To define the communication strategy and follow-up strategies. And lastly, to solidify your patient-physician relationship. So first, what questions to ask your healthcare provider before you leave? Or in other words, what questions should you be sure to ask? We're going to break this down into two broad categories. The first is relating to diagnosis and testing. The second relating to treatment and follow-up. So let's start with diagnostic and testing related questions. And the first question here really to ask that I think is an important one, although it may seem obvious initially, is what is my diagnosis? Now, this is important because symptoms themselves are not diagnoses. And this may seem like a subtle difference, but it's really an important one. So for example, in this slide right here, we have some common pain-related symptoms. For example, headache, palpitations, chest pain. In our field, stomach pain or bowel discomfort are common symptoms that patients will report. But these are just that. They're symptoms. These are not diagnoses. So a corollary diagnosis, for example, relating to stomach pain might be functional dyspepsia or peptic ulcer disease, for example. Or in the case of bowel discomfort, irritable bowel syndrome. These are diagnoses. And this may, again, seem like a subtle difference, but this distinction is very important. And why is that? Well, patients who are given a formal diagnosis are much more likely to receive effective evidence-based treatments for their diagnosis. So in one study that we did several years ago with the UCLA group, Lin Chang as a collaborator, we looked at the diagnosis of diarrheal predominant irritable bowel syndrome. And what we found was that patients that had a formal diagnosis of IBSD were much more likely to receive evidence-based approaches to treatment as compared to patients who were just told they had a diarrhea symptom or maybe just abdominal pain. So this is a very important element to your management in the long term. This also facilitates learning more about your condition. So once you know you have a diagnosis of IBSD, for example, it's much easier to learn about the current treatments, the current diagnostic strategies, et cetera. It's in essence easier to gain access to relevant information. That all being said, it's okay to not be 100% certain what the diagnosis is at the initial visit. And as a corollary then, I think it's appropriate to ask your provider, are there other or additional diagnoses that we are considering at that time? And this can be a dialogue that continues during the subsequent visits as you become more certain that you're dealing with a particular diagnosis. With regard to testing, I think it's important to establish when and how you're going to receive your testing results. Should you expect a call or will they be mailing the results to you? It's important to understand whether your provider participates in a patient portal system. A lot of practices are now offering this where you can have direct access to your records, and it allows you to be an active participant in the interpretation and following of your test results as they're performed. Never assume that no news is good news. All too often, an important result gets overlooked. And so, again, you want to be very proactive in following up on your test results. And then I think lastly, how to best communicate with the office and their office staff. So learning the names of the nurses and support staff that your provider works with is important. You'll know who to go to directly when you need to reach out to the office. Asking the provider, is it possible to speak directly to you in the event of questions or concerns? Very often, if you ask this, the provider will avail themselves to you, but it's important to clarify that up front. And I think an increasing number of offices are now using instant messaging systems, and this allows you, again, to have direct access to your providers through a different messaging means. What about questions relating to treatment and follow-up? Well, the first question I think that we all should be considering is what are the expectations for the particular treatment plan proposed. And as a corollary, which of my symptoms are expected to improve? So, for example, some treatments may be more effective at addressing certain dimensions of the underlying disorder. Sticking with our IBSD example, use of Imodium, for example, would be expected to help improve the diarrheal symptoms of the disorder, but would not be expected to have much benefit with regard to abdominal pain. Moreover, some of the treatments may not eliminate symptoms, but may make them less severe or less bothersome. So a good example here would be the neuromodulators such as nortriptyline. Very often, these medications will decrease the experience of abdominal pain, but they may not eliminate it altogether. They may just make it less bothersome and allow you to function better. So it's important to be clear on what we're expecting the medication to accomplish. It's also important to be aware that most treatments for functional GI disorders do not offer the prospect of a cure. These are chronic conditions, and we go into a strategy that focuses on maintenance of symptoms, a longitudinal approach to allow the optimal function of the individual. Very few things that we offer will have the potential to cure your symptoms and not have them be an issue for you whatsoever in the future. It's also important to know how long it's going to take for a treatment option to be assessed as effective or not in your particular case. So some treatment options may take a matter of days or weeks to determine whether they're going to be a good option or a good fit for you. Others, for example, again, in the case of nortriptyline, may take longer. They may take weeks to months before we really know whether they're going to be a good fit for your symptoms. So some symptoms may respond more quickly than others, and it's important to clearly establish what the expected timeline is for the response to a particular strategy. Also, clarifying what the options are for dose adjustments or adjunct therapies. If at a certain point symptoms aren't responding the way we would have hoped, is it an appropriate consideration to increase the dose at that point, or would we consider the possibility, for example, of adding an additional agent to that particular medication? The other side of treatment, of course, is dealing with side effects or adverse reactions and clarifying what side effects or adverse reactions we should be watching out for as the patient. Also, to know whether these should be expected to occur immediately upon initiation of a treatment or whether these could occur sometime down the road. So, for example, the GCC or guanylate cyclase C agonists, linaclotide and plecanatide, these are medications that are used for constipation. Diarrhea is sometimes a side effect that can occur within minutes to hours of the initial dose. But equally, often with these same medications, if you stick with them for a few days, those symptoms will start to improve. So it's important to know if I do experience a side effect, is it likely to get better after a few days or doses of the medication? And then to clarify what should be done in the event of an adverse effect experience. Should I stop the medication? Should I adjust the dosing? Or should I just call the office and get further guidance at that particular point? And then lastly, follow-up. What are the next steps or milestones that we should be monitoring after today's visit? Is the plan to have me call back and give a report of progress within a couple of weeks of starting a treatment? Are we waiting until I see you back in the office in a month or two? Knowing what the timeline and the strategy for follow-up is a very important point before completing the office visit. Now, what are some questions that healthcare providers wish people would ask of them? First question, can I make sure I understand the diagnosis and plan? I think it's critical, really, that the patient is clear on what the working diagnosis is and what the treatment strategy being proposed is. So take the opportunity to make sure that you and your provider are on the same page. And it's entirely appropriate to take notes. Very often, in the midst of the office visit, a lot of important information is raised. It occurs in a fairly rapid pace, and then you get home and forget what was discussed. So taking notes will allow you to solidify in your mind what the diagnostic and treatment strategy proposed is. I also like to hear patients asking whether there's anything else they can do to help control their symptoms. Allopathic providers or traditional practitioners of medicine often focus very heavily on medical therapies or prescription therapies, but I think it's important to remember that there are a lot of other approaches that we can implement to optimize symptoms in the long run. So things like diet changes, attention to appropriate amounts of sleep and exercise, stress management, all of these things have proven benefit in terms of improving symptoms, including pain. So there's a lot that we can do as patients beyond receiving a prescription in the ultimate control of symptoms. I also like to hear patients ask whether it's useful for them to monitor their symptoms proactively, to track their symptoms, their dietary changes, and so forth. This is a useful approach to providing some objective information about the progress that we've made, or perhaps in some cases the lack thereof. And it allows us to then, I think, make better decisions together with our patients about what the next appropriate step would be in their management. And then lastly, what are the best sources of information for me to learn more about my condition? I always like to have patients who are educated about their conditions, who want to learn more about their conditions. In some cases, the patient may come up with a treatment idea or a direction that we hadn't considered. And so always being an educated consumer of healthcare, I think, is critical to optimizing outcomes in the case of not just functional GI disorders, but medicine in general. And then lastly, what do healthcare providers wish people would say? So here are not so much questions, but I think just statements that I as a provider, find very reassuring in my interaction with the patient. So the first is, I trust your opinion and your recommendations. It's important to remember that providers who feel trusted are always going to work harder to earn and to keep that trust. So making that clear to your provider, I think, goes a long way in the patient provider relationship. Statements to the effect that you understand that this is a chronic condition and that it'll take time to get better, and also that you don't expect to be perfect, that your goals are realistic, and that you want to feel better and function better than you're currently doing at the moment. So providing some demonstration of realistic expectations, both in terms of the timeline for response as well as the overall response of your condition to the proposed treatment strategy. And then lastly, reaffirming your therapeutic alliance with your provider, a statement to the effect that you're going to work with that provider to get better. So in conclusion, your best chance of getting the best healthcare will come from you knowing three things. One, what it is that you want, having that introspection. Are you seeking diagnostic information and affirmation of a condition diagnosis, or are you interested in therapy? And if you're interested in therapeutic recommendations, taking it a step further, are we looking at trying to identify a pharmacotherapy and medication strategy, or some of these other augmentative approaches that have demonstrated benefit in functional GI disorders? The second point, where to go to get it. So again, this gets back to that educated consumer point. Knowing where to go, get the information, doing your research, and bringing that knowledge along with you to that office visit is very important. And then lastly, how to ask for what it is that you want. And this is, again, this point of self-advocacy, which is what I think this virtual advocacy event that the IFFGD is putting on is really all about. So with that, I will conclude. And once again, I appreciate the opportunity to be involved with this important event. Thank you.